Hi guys, and welcome back to my channel. If this is the first ever video that you've clicked on of mine, welcome to my channel. My name is Pip and I live in the northeast of England with my husband Anthony and our 3-year-old daughter Izzy. We make all sorts of videos. We do lots of vlogging, lots of shopping hauls, speed cleaning, organisation, all sorts. If that sounds like your cup of tea, I would love for you to press that red subscribe button down below and you will be kept up to date of any new videos that I upload. Today's video is a little bit different. Today I'm going to be talking about my tooth implant. When I was doing research into having a dental implant, obviously my first port of call is always YouTube, and I couldn't find anything from a patient's point of view. There were lots of videos made by dentists about the technical aspect of having a dental implant, but nothing from a patient's point of view, and I wanted to find out about the procedure from start to finish, what was involved in the appointments, did it hurt, what did it feel like, but there wasn't really anything out there. So today's video, I'm hoping, is going to answer all of your questions you have about a dental implant, what the procedure is like, what happens at each appointment, and also maybe give you some reassurance that the dental implant procedure isn't quite as scary as it sounds. I had my dental implant done at the Cosmetic dental clinic in Newcastle by my dentist, Dr. Darren Cannell, and I could not recommend that dental practice enough. I've been going there for the past 10 years and I'm 100% happy with everything that I've ever had done there. The team are like friends really, and they put you so much at ease. This procedure was the scariest for me out of everything that I've had done. In the past I've had 4 veneers on my top 4 front teeth, and I wasn't really worried about having that procedure done, but having a dental implant, I think there's something about having a tooth removed and then something inserted into your jaw that slightly freaked me out. But the team there could not have reassured me more. They were absolutely fantastic. And if you're looking for a private dental practice, if you're wanting to have some extensive cosmetic dentistry, I couldn't recommend them enough. I will leave a link to their website below. They have a dental practice in Newcastle city centre and a brand new super duper practice has just opened in Durham. The dental practice itself, it isn't like your typical dentist. If you think luxury boutique hotel, that is more along the lines of what the Cosmetic dental clinic is like. It really is lovely, and I would not go anywhere else to have my dentist treatment done. So I have had a dental implant on one of my top 4 teeth, and I bet you can't guess which one it is. It's this one here. That's my dental implant. And I started to have pain in that tooth just after my daughter was born in October 2014. It was a low-grade pain, but it was consistent. So I popped along to see Darren, my dentist, and we tried all the non-invasive treatments before we even started thinking about an implant. So I had a mouth guard, which I will show you what that looks like. So this is my mouth guard, and I wore this for a couple of months to see if that would eliminate the pain. One of the thoughts was that I was grinding my teeth in my sleep, so I had a mouth guard made. We also filed down the tips of my top teeth and bottom teeth, and we also put a composite filling on this tooth there to try and stop me from grinding my teeth sideways in my sleep. Unfortunately, none of that helped. We then went on to the next stage, which was root canal. So all in all, I had 3 root canals on that tooth, none of which helped, unfortunately. And what we think has happened is that when I was in labour with my daughter, puffing away on the gas and air, I bit down on the gas and air and cracked the root of my tooth. We think it's a hairline fracture, but because sometimes hairline fractures don't show up on x-rays or CT scans, we weren't 100% sure, but we'd tried every other possible treatment and I was still in pain. It was a low-grade pain, so maybe a 3 or 4 out of 10, but it was constant and it was really getting me down. So the only other option was to have a dental implant. So the first step in the procedure is to have an x-ray and a CT scan. The CT scan is to check that I had the bone density available to have an implant inserted. Luckily I was, so we were okay on that front. The CT scan sounds a little bit scary, but it really isn't. It's just like having an x-ray. So you stand in the middle of a machine and you bite down like you would when having an x-ray on a little tiny bit of plastic, and then the machine just turns around your head and takes an image of your bones in your jaw from every angle. The next appointment was to have impressions taken of my teeth. So that is where you have a little tray inserted into your mouth that's filled with plasticine type material, and you pop it into your mouth and bite down and wait for it to dry, and then it's taken out and you have a impression of what your teeth look like. Darren also took lots and lots of photographs of what my teeth currently look like and did a colour match to send off to the lab. So all of the x-rays, the impressions and the photographs all get sent off to the lab to make up the crown that will be the finishing part of the implant, but also to make the temporary denture. So this is my temporary denture. So it has a plastic plate at the back which fits into the roof of my mouth, and one teeny tiny little tooth on the front which fills the gap where my tooth was removed. And as you can see, it's an absolute perfect match with my other teeth. I thought I was going to hate wearing the temporary denture, but it really wasn't a bother. It took maybe a day or so to get used to it, and I used to take it out to eat and it was fine. It wasn't a problem at all. I did buy some of the Fixodent adhesive. I used that once or twice, but really I didn't need it because the plate itself is made so well that it fit perfectly at the roof of my mouth and stayed there without any bother. It took the lab about 2 weeks to make the temporary denture, and I then went back in for another appointment to have my tooth removed. It normally takes about 3 months or so between having your tooth removed and having the first part of the implant inserted, so it gives the bone time to heal so the implant has something to screw into. I have very short roots, so I was able to have my tooth removed and the first part of the implant inserted straight away. Once my tooth was removed, my dentist Darren used a teeny tiny drill to drill a hole into my jaw where the first part of the dental implant could be inserted. I'm going to insert some pictures here now of what my gum looked like after that appointment. So as you can see on the picture, I have stitches and I also have a tiny little metal cap. That is covering the first part of the dental implant to keep it all nice and clean. I then had to wait 3 months for my next appointment. This is to allow the bone to knit back together around the dental implant that's been inserted. After the 3 months, I went back in to have the crown fitted on top of the implant. So this is the tooth part of the implant, and I'll pop some pictures in here so you can see what the crown part of the implant looks like before it's inserted. So the lab have used photographs and impressions, and also the tooth that was removed was also sent to the lab so they could make an almost exact replica. As you can see at the back of the crown there is a teeny tiny hole, and that is where the screw goes that screws into the first part of the implant that is fixed into the jawbone. Here is a little clip of Darren, my dentist, screwing the crown into place. I was absolutely over the moon once my final crown had been fitted and screwed into place. It looks and feels like a real tooth, but most of all, I have no more pain. The nature of a dental implant is that the crown is going to be slightly thicker at the back, as you need that channel available for the screw to go into to screw it down securely into the implant that is embedded into your jaw. I did have a few issues where I felt that it was a little bit too thick and it was causing me to lisp slightly. I did go back for another appointment to see Darren and he filed that down, so now it's absolutely perfect. My dental implant looks and feels like any of my other teeth, and I hardly think about my teeth at all now, which might be a strange thing to say, but from having constant toothache and thinking about having tooth pain every day to not even thinking about my teeth is just wonderful. I feel as if I can lead a normal life now. Previously I had to drink cold and hot drinks through a straw because the pain was that bad. I couldn't bite down using my front tooth. I had to cut up everything into tiny little pieces. Even sandwiches were difficult. And I just think having a tooth implant was the best decision that I ever made. I hope you found this video useful, and hopefully I reassured you a little bit about the procedure. I think finding the right dentist is key. If you live in the northeast of England, I couldn't recommend the Cosmetic Dental Clinic enough. Darren and his team are absolutely brilliant. If you have any questions, please leave them in the comments below, or you can find me over on Instagram. I'm on there every day, and you can find me at pip.milburn. Thank you so much for watching. If you found this video helpful, give it a big thumbs up, and don't forget to subscribe, and I will see you in my next video. Goodbye!